Hello guys, I'm Dr.HRITHIK.DANCER, General Physician. Welcome to HK Professional Health and Education channel. Okay, today the topic is we discuss about abnormal heart sounds. Okay, first we know to the what is abnormal heart sound. It is condition of pathological and some physiological condition of releasing high pitched sounds in the heart. Okay, these are some underlying causes we discuss later. Okay, abnormal heart sound it is four types. S1, S2, S3, SO. In S1, S2 we can audible with stethoscope clearly, okay, and S3, SO it is unable to audible in stethoscope due to some underlying pathological and physiological causes, okay. Abnormal heart sound it is some causes like aortic stenosis, ventricular stenosis, aortic regurgitation and ventricular regurgitation. Means stenosis means excessive calcification in the valve of the heart and ventricular region also. Okay, and regurgitation means it is unable to close tightly valve during pumping of the blood flow to the heart. Okay, means it is loosely closing of the heart valve of the heart. Okay, it can leakage blood return to the valve and ventricular region of the heart. Okay, it can leakage blood flow, okay, during pumping of the blood. Okay, and some bacterial infection causes and some rheumatic fever means excessive viral condition of the body. Okay, these are some condition. During some pathological condition valve become narrowing in the region. It can increase pressure blood flow to the directly to the abnormal rapid filling of the blood to the ventricular and aortic region. These are causes abnormal heart sounds. Okay, and investigation. First we know where to find out abnormal heart sounds. Okay, in region of using stethoscope like pulmonary and aortic region. These are main two areas we find out the abnormal heart sound. Okay, in lab investigation like some another investigation like 2D echo, these are another lab investigation directly find out the heart condition of the body without using stethoscope. Okay, and symptoms we notice sweating, headache and fear and anxiety. These are some condition of the symptoms we notice in patient. Okay, and management. First we correct the normal heart weight, body weight of the persons, maintain healthy fit of the body, eat healthy foods, diet, fruits, vegetables, fresh foods. Okay, these are some management. Okay, and maintain healthy proper weight of the body. Okay, maintain cholesterol level of the blood. Okay, regular checkup of the blood in a lab investigation, maintain the routine. Okay, these are some management. Okay, today topic is over. We meet on the next one. Bye, love you all.